Good afternoon. My name is Jerome Bailey, and I'm with the ESRD National Coordinating Center. Thank you for joining us today for the ESRD NCC Patient Education Webinar event. The ESRD NCC webinar events are held in partnership with the Centers for Medicare and Medicaid Services. The calls feature patients and professional subject matter experts from around the country sharing how they or their organization are coping with situations related to COVID-19. Before we get started, I wanted to let you know this call is being recorded and will be posted to the NCC COVID webpage, usually within 3 business days. Many times we have the recording up on the webpage well before 3 business days. Let's take a look at today's agenda. Today we are happy to have Dr. Daniel Cukor of the Rogosin Institute and Glenda Roberts of the University of Washington Kidney Research Institute. Our topic for today's call is living in a COVID-19 environment, mental health support for kidney disease patients and caregivers. So what's this call about? You'll hear from experts who share tips for coping in a COVID-19 environment. We'll provide real-world experiences for others to put into use. And we'll talk about how we engage in biweekly calls on varying topics. Before we start with our presentation, we wanted to let you know about one of the many COVID-19 resources developed by the ESRD NCC. This one that you see on your screen is called Tips to Help You Boost Your Physical and Mental Health During COVID-19. This document was developed with the help of patients and caregivers. It offers practical tips to help you better deal with stress and anxiety. Visit kidneycovidinfocenter.com to download this resource. So let's begin with our presentation. As our panelists go through their presentation and you have questions, please submit them using the chat feature through WebEx or the Q&A on the lower right of your screen. When we get to the question and answer section of this presentation, we will share the questions we have received with our speakers. Our goal is to answer as many questions as time allows. So let's learn a little more about our first speaker. Dr. Daniel Cukor is the Director of Behavioral Health at the Rogosin Institute, a kidney treatment and research institute in New York City. He received his PhD in clinical health psychology from Furkoff Graduate School, sorry about that. His research and clinical focus has been on the psychosocial issues relevant to patients with end-stage renal disease. He has done work developing and testing treatments for depression, insomnia, pain adherence, and anxiety for people with renal failure. He lectures frequently on psychosocial issues for patients with chronic kidney disease and has written extensively in the scientific literature, with his work cited in over 3,500 times. Let's welcome Dr. Daniel Cukor.
Hi, everyone. This is Daniel Cukor. I just wanted to thank the ESRD Network for the opportunity to speak with you today. So I have prepared some comments, some remarks today, but I really hope to have a dialogue and some questions, time to answer the questions at the end. So please feel free to shoot those questions in the Q&A box. That would be great. Okay, why don't we go on to the next slide? So I have titled my talk today of Coping with the Pandemic Strain, and I think these 2 pictures really highlight, at least around here in New York, what I'm hearing from people. It's a combination of really desperation on one hand, exhaustion, and on the other hand, a bit of optimism that the vaccine is around the corner and perhaps an end to this pandemic and COVID era. Okay, next slide. Another way of describing this is to think about where are we in this roller coaster that we've been going through. So we went through this first wave. Now we're going up this other path. When I put the slides together, it was not yet clear whether there was going to be a rise in incidence after Thanksgiving. Certainly that seems to have unfortunately played out that there is. We don't know yet if Christmas and New Year's will lead to a rise in incidence. But, kind of where are we in terms of, as a nation, in terms of dealing with COVID? But I think, what I'm going to be talking about is really where are we in terms of, as human beings, in our ability to cope with all of this. Next slide. So I have, in my work here in New York, I've been working directly with patients with all varieties of kidney disease, and some of my work has certainly been focused around coping with COVID. And here are some of the things that, that I'm hearing from people, and you can let me know whether this resonates with you and whether you guys are feeling the same way. But, can I handle this again? I'm here in New York City where it hit really hard in March and April, and then it was relatively quiet through the summer. But now as the winter has been getting worse, it is just, people are kind of going back to some of those challenging feelings that they felt early on in the pandemic, and they just are wondering whether they can do it. Is it safe to travel? Is it safe to come into the clinic for their doctor's appointments? They want to know, what are the dialysis centers doing to protect patients? Is there going to be spread within the unit? What if they do have COVID-19? Will they die if they get COVID-19? What are the long-term implications of it? Is it safe to be around their family? Should they distance from themselves, from each other when they're at home? Should they just stay home and not go out at all? And then many of us are dealing with feelings of grief and loss and stress and depression. One bit of information that I saw today is that, the numbers that we see of the loss that has been experienced due to COVID-19 really only represents the loss of human life. But if you include the people that are directly impacted by the loss of those lives, it's obviously several-fold larger. Millions and millions of Americans have been personally touched by grief and loss related to COVID-19. Next slide. So I think, what we're experiencing, as a people is really best described as burnout. It's just been too long a time that we've been going through all of this emotional roller coaster. And burnout is something which is, described as being emotional exhaustion or depletion, like there's just nothing left in the tank, is what I'm hearing. Patients, the nurses, the technicians, the doctors, just really everybody has, it's been so hard on everyone for so long that it's getting to the point where it's just really, really difficult. And for some people, it's going beyond just feeling the, regular exhaustion or depletion, but they really are having feelings of being overwhelmed or constantly worried. They notice that they're more irritable than usual. There's changes in their sleep patterns. Maybe they have somatic symptoms like headaches or other types of aches and pains. And, as we know, as a nation, we have been turning to unhealthy coping mechanisms more frequently. The rates of alcohol and drug use have unfortunately gone up during the pandemic. Next slide. So one way that I would like to kind of think about this, or to present this, is with this concept called allostasis. And this was originally described by Bruce McEwen. And allostasis is like the cost of stress on our bodies, both emotionally and physically. So, when we have to respond to stress, we have to muster the reserves to respond to it. And, that costs us something. That costs our immune system, it costs our mind, it costs our body. There is a price to be paid whenever we go under stress. And this graph in front of you really highlights what a normal stress response is. So something stressful happens, and we mount this response, and then slowly, over time, we kind of go back to a full recovery. And that's what, a typical healthy stress response looks like. Next slide. If we have multiple stressors or consecutive stressors, one after another, so then we just have this cycle kind of happening again and again. Something bad happens, we respond to it, we go down all the way to the full recovery, and then something bad happens again, and we respond to it, and kind of again and again. This is what happens. This is, like, unfortunately, the course of human life in response to all the different stresses that we have. Next slide. I think 2020 has really been a bit more complicated than that, because all of the issues that we're experiencing are not really happening sequentially, one after another, but in many ways they're happening on top of one another. So we have, issues that are really complicated political issues. We have issues around quarantine, which are different than the actual illness issues, and plus all the other challenges of 2019, that it all piles up to adding into something which is, I think, a little bit different than perhaps the types of stress that we've had in previous experience. Next slide. So what I'm hearing from patients is, that they're really all of their life domains are being simultaneously being challenged, that they're experiencing health challenges, and that might be directly related to COVID-19, or the changes to their health care, how they're interacting with their doctors, the frequency of their interaction with the doctors, what tests they can get, what tests should they postpone. Home responsibilities have changed. Family responsibilities have changed. Many people have older relatives, even though, as a group or a vulnerable group, we're often connected to other people who are vulnerable, caring about them. Significant others, whether we are the identified patient ourselves or someone who cares for them. There's just a tremendous amount of stress on everybody in who's taking care of all of the additional responsibilities that are associated with safe living in the pandemic. And then our community resources are all being taxed. It's just hitting in a wide net in all of the different areas of our lives simultaneously. And while all that's going on, there's also a withdrawal of our usual means of support. So we can't get together with friends. We can't go to religious gatherings. We can't do many of the things that we used to do to help us get through these difficult times. Those things have been removed from us as well. Plus, all of the people that we perhaps rely on are going through something, very similar to what we're going through. So, it's hard to have extra emotional reserves for other people during this pandemic when, everybody's getting stretched to their limits. Next slide. So, one way of thinking about this is what we would call a compounded stress, which is when they're kind of one on top of another. So instead of the stress, us recovering from the stress each time before the next wave hits, like there's this, like waves crashing on the shore before one really goes away, the next one is hitting. And what happens is that the peak of each wave becomes higher and higher. So we're just having more and more stress, and we're not really able to recover in between. So that's one way of, not a very optimistic way, but one way of thinking about all the stress that we are going through. And what I would like to, spend the rest of our time really talking about is, whether there's an opportunity here to really frame this in a different way so that we can come out of this experience perhaps a bit stronger than we were when we went in. Next slide. So a quote from Henry David Thoreau: "Not until we are completely lost or turned around do we begin to find ourselves." So the idea is that from challenge, there can become opportunity. That's kind of a poetic description of that. Next slide. This is something that I've come across that I think is just a really nice idea. It's called Kintsugi, which is a Japanese to repair with gold. And it's, as you can see these pictures in front of you, it's the art of repairing pottery with gold lacquer and understanding that the piece is more beautiful for having been broken. So it's shattered and then put back together with this gold, with gold and with paint, and you can see how beautiful the bowls are. Next slide. And in psychological terms, we call that resilience, or what has been termed post-traumatic growth. Once you've gone through something, becoming stronger as a result of it. So it's a positive psychological change experienced as a result of adversity and other challenges in order to rise to a higher level of functioning. So sometimes going through something difficult will make us stronger for the future. If we go through something again, which is similar, we have built some strengths and some reserves around how to handle these types of challenges in the future. Next slide. And this is the model that I prefer to think of, and this is what is called adaptation to stress. So it's not that the stresses are kind of lapping up against us one at a time, but rather after we survived that first wave, the second wave is just doesn't hit quite as hard. We've learned some things about ourselves. And then the third wave, if it happens, or the third time we get stressed, we'll have learned even more from the second time. So we now know things that we didn't know before about ourselves. We know what we can cope with. We know how hard we can be pushed. We know which things we're not going to be able to compromise on and how to prioritize those and perhaps how to care for those or to plan for those events. So there are things that we have learned about ourselves, both emotionally and maybe, quarantine living, that will prepare us for challenges that we are going through now. So we're not as naive or as new to this as we were back in, early March or in April. Next slide. So in my conversations with people over, the last 8-9 months, I've really come up with what I think are primarily 3 recommendations, what I call the key skills for thriving and surviving. And sometimes it's hard to know the difference between whether we're just surviving this or whether we're thriving, but we aim for thriving. And those 3 skills, which I'm going to talk about, each individually now, are really managing worry, remaining socially connected to one another, and developing healthy life rhythms. And I'll explain each of those. Next slide. So managing worry. There's just a lot of concern that is out there in the world right now. We're all experiencing this additional amount of anxiety. Next slide. What if I need to go to the hospital? Will my healthcare team be okay? Will I get infected? Will I get sick? Will I need to change shifts or sites? Will anyone I care about become ill? Is the vaccine safe? How do I go about getting the vaccine? These are all major questions that are of concern to all of us. And, they do cause a lot of anxiety. Next slide. So some suggestions for how to deal with anxiety are, to think about whether it's productive or unproductive worry. Is there a helpfulness or a usefulness to this particular concern that you have? And if you can't change it, there's really no value in worrying about it. Will I get the vaccine? Will I not get the vaccine? So that's an important question for everybody, and certainly we hope that people will go and get the vaccine. And once you've signed up for it, or if you're on the list through your center or through your healthcare provider, so then there's really not much more that you can do at that point. So then you just wait until your turn comes around. And whether we have opinions, and we all have opinions about whether it should go faster or how it could be better, in essence, no, that's not where we are right now. We're just kind of waiting for our turn to come. So we just need to wait patiently. Next slide, please. Another suggestion is to focus on the now. Many people get caught up with worrying about what the future is going to look like. What would happen if this happens? What will happen a month from now? How much longer can I take this for? So, when you're starting to feel overwhelmed like that, I encourage people to really think about, what is the situation which is in front of you right now, which is stressing you? What do you need to do right now for yourself to help yourself get through? And whether we're thinking about just the next 24 hours, the next week, the next 3 months, if we think about it as a small amount of time, it often becomes a lot easier to deal with. When we think about, can I deal with this indefinitely? I think the answer for everybody is probably no. But if we think about, okay, what do I need to do now to be safe, to be okay, to be well for this next short amount of time, usually more answers will present themselves. Next slide, please. And, if all else fails, if you really can't change certain things, so then there is a powerful value in the idea of acceptance, of just understanding that things are the way that they are, even though we wish for them to be different. But for right now, they are the way that they are, and we can rage against it or not rage against it, but it's not going to change much. And in this picture, you can see, it's raining. And on the one hand, we see somebody saying, I don't like the rain. I wish it wasn't raining. My day would be better if it wasn't raining. My day is ruined. Every day is like this. Why does it always rain the most when I want it to be sunny? It's never going to stop. Those might all be true sentiments. But acceptance looks like, yep, it's raining. It is raining. That's just a fact. And I think no matter how much we don't like it or how inconvenient it is for our lives at the moment, at this moment, it is unfortunately raining for us. It is a really challenging time that the world is going through. But we just have to accept that for now, it is like this. Next slide, please. So the second of the 3 things that I really wanted to talk about was social connection and the importance that we have as human beings to be connected to one another. Next slide, please. So it's been really, really hard to connect and to stay connected with people because all of our usual ways of connection have been removed and or changed. And what I will ask all of you to do is to really challenge yourselves to create ways of remaining connected and to infuse meaning in your life in ways that are different. So the ways that we used to do it are probably the ways that we would most prefer, but given that if those ways are still not available to us, what might be a good enough second option for us? And, many people are having more time at home and less time kind of doing the things that they used to go around doing. And that can be, both a blessing and a curse. You can feel, very overwhelmed and disconnected, but it is also possible that people can be thoughtful about how they choose to spend their time. And depending on how you choose to spend your time, you might find that there's actually some ways that you can find meaning. So, one of the most important things is to connect your actions to your priorities. So to sit back and to say to yourself, what is the most important thing to me? What are the most important values that I have in life? And what can I be working on towards those things? Is there anything that I can do to kind of reconnect with some of those values? And it might not be the way that I've done it in the past, but maybe there's an opportunity here to do it in a bit of a different way. To be productive. So, here I have some little pictures there for you to look at. One of the people that I work with is a physician in training, and because of COVID, their entire kind of training experience has been totally turned upside down. Their life plans really have been turned upside down, and they have found themselves, instead of being very busy engaged in medical care, they are unfortunately, on ice at home, waiting for COVID to pass before they're able to get more involved in their training. And this person, instead of kind of sitting around and feeling sorry for themselves, they decided to take advantage of the time and learn medical Spanish. And, they first signed up for the 1-month course because that's how long they thought they were going to be out. But now they're moving on. It's 6 months plus, I think, at this point. And they've, from what I hear, they have become quite proficient in their Spanish. So they took something, which was a real negative, and they've now turned it into a potential positive for their career and for their patients. Similarly, there's a patient that I work with, who's an elderly man who said he always wanted to learn how to play guitar, but never had the opportunity to do so. Who's been so busy in his life so active. So, at some point I said, you've always wanted to play guitar. You've shared that with me. What better excuse could you have than being locked away, in your apartment, for hours on end with really not much else to do? Maybe it's a good time to pick up the guitar. And, he has, and he's got Zoom lessons, and he learns how to play guitar, and now even participates in little Zoom concerts. And it's not the way that he would have liked to learn, and is certainly not, ideal from any perspective, but it is something which is meaningful to him. And when he comes out of this, he'll be very proud of the fact that he's channeled some of that energy into something productive. And there is one of the social workers that I work with was really, very sad in March and April about the disconnection from her family. She lives she lives here in New York, and her family is elsewhere, and she couldn't travel home. And it was just, it looked like it was going to be months, and indeed it has been, 9 months since she's been able to see her family. And one of the things that she was able to do is that she said, what's most important to me is really being with my family, and she loves the holidays. So one of the things that she started in April was she started crocheting, handmade gifts for all of the people in her family. And, she thought it would be cute, then she'd do it for a month, and then it turned into 2 months, 3 months. So what ended up happening was she made gifts for everybody in her kind of very large, extended list of people that she might send gifts to. And she was really hoping to give it to them, for the holidays, but unfortunately, was not able to travel home for the holidays, but sent these gifts to everybody. And everyone really appreciated, the personal touch that she put into the thought for each of their gifts and the amount of effort that she put in. So to me, it was like a 2-for-1. It was an opportunity for her to kind of remain connected through March and April and May and June, all the way through the holidays, and then really be able to connect with her family. So it really worked out very nicely for her. I have one patient that I see who's an 84-year-old woman who lives alone in New York City, and she has grandchildren who are in college or older all across the country, and she rarely gets to see them. And during COVID, she said, why don't we meet once a week and online and play a word game together? They play these games online. So she has her grandchildren from all over the country log into this game, and the 7 of them play games all together. And she was extremely proud that one day she had beat all these smart kids in some sort of online word game. She was very proud of herself. It really feels, very connected to her grandchildren in a way that she was not really able to connect with them before the pandemic. Next slide, please. So the last thing I really want to talk about is what I've called healthy rhythms, or having different patterns in our lives that promote health. Next slide. So there are 3 main areas of our lives that really have been hit very hard by quarantine, by the pandemic, that we really, to feel good, we need to have healthy rhythms, or a good schedule around. And I said here that we're built for routine, and that's not hyperbole. We really are, and it's not just our brains. There's all this new research that shows that there's essentially these clock cells in many of our organs that really, we function better, more optimally when we are on a natural rhythm or in a natural schedule. I think we all know the effects of, say, like eating too late at night, or eating the wrong foods, how kind of disruptive that can be to our bodies. So that's true, in a very obvious level with examples like that, but it's just generally true that the more in rhythm we are, the more optimally our bodies will function. So many of us have the tendency to, eat differently during this period. Some of it is, food availability. Some of it might be also just, we're not doing our regular activities, so we're not eating in the regular places. There's more access to food for some of us. So we just want to be careful that we're eating healthy and that we're eating, at, the right amounts at the right times. Similarly with sleep, many people, are staying up later than they used to, waking up later, their days are shifting, their schedule is kind of becoming distorted, and that can be a real challenge to feeling healthy. And similarly, exercise, many of the usual ways that people would exercise are really not that safe. So we need to be creative in thinking about ways that we can exercise to keep our bodies healthy and in rhythm in ways that are, still pandemic safe, that are kind of approved and appropriate for doing during this time. So we want to really think about, developing a nice and healthy rhythm around how and when we eat, how and when we sleep, and how and when we exercise. Next slide. So what I will kind of conclude with here is just some steps that I've outlined for how to build resilience on a personal level. How do we go about learning from all of this adversity that we've gone through? And I think the first step is to start with an honest assessment of what's going well and what's not going well. Where do we need help? Am I eating all right? Am I exercising? Am I not exercising? Am I coping well? What's happening for me, that's in the kind of strengths column, and what's happening for me that's in the I need to work on column. And the second step is develop what we call an asset map. Who and what resources can you draw upon? And here I really encourage you to connect to others. There's so much goodwill that's out there right now. People want to be able to help one another. Everybody's feeling lonely. Everybody's feeling disconnected. Just take that first step and reach out to somebody and say, hey, I know we can't get together the way that we used to, but, do you want to meet on Zoom? Is it all right if I give you a phone call? Can I give you a text? Just to connect to people in ways that perhaps we're not used to, but it feels so good. It's part of our natural, makeup that we need to feel really good. Most of us really require a high amount of social connectedness. So if you find that you're struggling in a particular area, you can do this kind of 2-for-1 where you can get some help in that area. And then you can also have an opportunity to really connect with somebody else. And then, the third step is to acknowledge your emotions. This is hard, and denying it is not really going to work. So many of the people that I work with in the beginning kind of put their heads down and they said, I'm going to soldier through this. I'm going to get through this by being, really disciplined and tough. And then after a little while, that you can't maintain that level of emotional discipline for too long. And then it's just like, you don't know how to respond. You're overwhelmed with your emotions. So having a strategy for dealing with the emotional side of this, I think, is essential. We have to acknowledge, no matter how well or how poorly we're coping, that this is a real challenge emotionally to cope. So we need to, like the skills that I talked about earlier, of managing your worry, put those into place. The next step is to develop a plan for moving forward, like literally to write it down. I am not exercising enough. What am I going to do? I'm going to start, walking around my block, one time each day. I'm not eating healthy enough. I'm going to make an attempt to cook more healthy foods at least 2 nights a week. So literally write down a goal for yourself. I mean, it's New Year's. We have New Year's resolutions. Maybe that dovetails nicely for us, but to literally have a piece of paper that is written down that has the plan, not only the goal, but a step-by-step plan for how are we going to work towards achieving our goals in this next week. I think we need to also include in that a plan for self-care. How are we doing with our sleep and our exercise and our eating? If we are not able to take care of ourselves, we're really not going to be able to take care of one another all that well. So if our goals are around being there for our family or supporting one another, we have to do some work on ourselves as well to make sure that we are optimized so that we can care for other people as well. And like I said, we want to develop short-term attainable goals. We want to say, what can I do this week to move me forward along this path? If you just look at the mountain, it's really sometimes intimidating to climb, but if you just look, at the next few steps ahead, you can say, yeah, I could do that. And then after some time, you look back and you'll be impressed with how far you've come. And I would celebrate your successes, even if they seem minor to you or they're minor in comparison to what you could have done if it wasn't a pandemic. If you've done the things that, if you've set out some things to do and you've accomplished at least some of them, be very proud of yourself. This is not a time where it's easy to succeed at anything. So if you've accomplished anything, be very proud of yourself. And then, balance that with the last one, which is to accept that some things are just very challenging now. And that I really hope, in the near future, there will be, the world will look different. The pandemic, the vaccine is here. Hopefully people will get it and it will be, at a rate which will allow us to return quickly to, normal living, whatever that might mean in these times. But, there's rays of hope here. So what we need to do is we need to have kind of one last push to be able to help ourselves get through the next few months so that we are able to come out of this a bit stronger than we were, perhaps, than we first went in. Next slide. Thank you very much. Oh, there's a slide. And I just have listed here a couple of resources, that are available, that are from, national organizations that you can find some more information. And again, I'm happy to take some questions at the end. Thank you all.
Thank you, Dr. Cukor. Lots of great information, and I'm sure our audience does have a lot of great, good questions for you. But before we get to their questions, we want to hear from our second speaker. Glenda Roberts serves as the Director of External Relations and Patient Engagement at the University of Washington Kidney Research Institute and the Centers for Dialysis Innovation. Ms. Roberts is involved in many national and international transformative healthcare initiatives, including the Kidney Precision Medicine Project, Kidney Health Initiative, Patient and Family Partnership Council, the American Society of Nephrology, COVID-19 Rapid Response Team, and many more. A kidney transplant recipient who was diagnosed with kidney disease as a young adult, Ms. Roberts has firsthand knowledge of the challenges faced by patients and families affected by kidney disease. Welcome to the call, Glenda.
Thank you, Jerome, and thank you to the ESRD Network for inviting me to speak with the audience today. Next slide, please. So I started staying at home long before most other people did. I had gone to a conference in Charlotte, North Carolina in late February, or at the beginning of February, and there was a rainstorm that resulted in a tornado. Now, that should have been a sign because it was a little early to have tornadoes in Charlotte. But at any rate, we got stuck and couldn't come home that night, and we had to try to find hotel accommodations late in the evening. So at 1 o'clock in the morning, I'm standing outside in the pouring rain. It's cold. We're trying to wait on our Uber driver to pick us up. When they finally arrive, they take us to a hotel. We arrive about 1:30, and at 5:30, we had to be back at the airport. So clearly I didn't get much sleep. The weather wasn't good for me. And by the time I got home, I was starting to really have a pretty bad cold. So I decided that I would work at home until my cold got better, because I sound so terrible. People think I have something that is far worse than it is. And I didn't want to subject my coworkers to possibly getting my cold. So I started staying at home. Well, as a result of working at home, I had a lot more time to pay attention to the news and what was going on around the world, and I saw that COVID-19 was starting to spread. By February 29th, I was really alarmed because we had the first fatalities of COVID-19 in the Seattle area, literally in Kirkland, Washington, which is right next to where I live. And the people that had gotten sick and subsequently passed away shared my grocery store. That is, we both shop at the same Trader Joe's. So I started sounding the alarm to all of the people in the kidney community that they needed to be aware and wary of COVID-19, in part because I'm a part of the leadership of the Kidney Research Institute. So I knew that the people that had been affected first were people that were living with kidney disease like I was. And I wanted to make my community aware without alarming them. I also started to make the people at work aware that, COVID-19 sounds like it's pretty serious, because people were dying at a pretty rapid clip at this one long-term care facility. And I have to be candid, most people were saying things to me like, oh, don't worry, it's very unlikely that you'll get it or that any of us will get it. And I was like, I'm a kidney transplant recipient. I know how to take care of myself, and it is not exposing myself to this virus. I also did some research at that time about the 1918 pandemic, and I saw what some of the patterns were in terms of what they did in St. Louis and what they did in San Francisco, and in places where they didn't protect themselves, it ran rampant. And in places where they did protect themselves, they thought they were safe, and then they went back to behaving as normal, and there was just a severe outbreak of the disease. So I was very cognizant that it was likely that this disease or this virus was going to be like that. Next slide, please. So because I was so apprehensive, I immediately self-isolated with my husband. We stocked up on all of the essentials. I set up an Instacart account so that they could go and do the shopping. I reactivated my Amazon account, and I had to use a lot of discipline not to use it just to buy clothes and stuff, but to buy the essentials that we would need in order to be able to self-isolate. And everything is delivered, and it has been since the beginning of February, and it sits out on the front porch for at least 24 hours. And after 24 hours, my husband goes out and he disinfects it. Next slide, please. So I posted a sign on my front door that said that someone in this house has a weak immune system. So if we don't answer the door, don't get your feelings hurt. And if you have packages, leave them at the front door. We will get them after the required isolation period. I actually worked with one of the other transplant recipients, and we wrote an article about our experience, and we included this sign in the article so that other people who wanted to get people to stay away from them would be encouraged to do that. Obviously, I eliminated all travel and continued to work at home, but I also did a lot of research on physical distancing and how far a sneeze could go and how far a cough could go. And I found that the distance wasn't 3 feet as they initially suggested, or even 6 feet as is currently recommended, or the 13 feet that shows up on some places on the CDC site. but rather droplets from a forceful cough can go up to 27 feet. So I don't go around anybody except my nephrologist and the phlebotomist. My friends want to come over and visit, and we tell them, no, we're not accepting visitors. My only child and his wife have not been in my house since January of 2020 because we want to make sure that we all stay safe and stay distant. Next slide, please. So initially, I found that COVID-19 was very stressful, both physically and emotionally. And I decided that I needed to focus on what I could control. Like, I couldn't control whether or not there was going to be enough toilet paper at the store. I couldn't control whether or not other people were following the rules of social distancing, nor could I predict what was likely to happen. But I could control what was going on in my own life. So I decided that I would maintain, as Daniel suggested, some routines and habits. I get up every day and I get fully dressed. Like now, as I talk to you, I am fully dressed all the way down to my stockings and my shoes. I also make sure that I exercise on a daily basis. And I expanded the amount of work that I was doing. I mentioned that I had written an article. Well, since I have been isolated, I've actually written more than 5 articles with different people. I joined the ASN COVID-19 response team because I felt early on we weren't really getting a lot of good information for people that were living with kidney disease, particularly for people that had a kidney transplant. So I reached out to ASN and voiced my concern and shared some information that I had gathered, and they invited me to serve on the task force as the patient representative. I also joined the EGFR and RACE task force that is being sponsored by the National Kidney Foundation and the American Society of Nephrology, and I've conducted several webinars like this with Daniel as well as many other people. We have Zoom family meetings and Zoom holiday dinners, and we have found that by asking people to turn on the cameras, so we don't let people just join our meetings without turning on the cameras, because you get a lot of cues from the physical interaction with people, and since we can't physically be together, seeing people's reaction tells us a lot more than just listening to their voice. Next slide, please. I also have increased my exercise. So I use Zoom for a lot of things. I don't see it as a burden. I see it as an opportunity. I host weekly mocktail hours with one of my girlfriends. We talk from 5:15 to 9 every Friday evening. And because we haven't really been talking to anybody else, we have enough information to fill up the complete 3 hours and 45 minutes. I hired a personal trainer that I meet with twice a week. I met with her this morning for 30 minutes, and I'll meet with her again on Friday. And I've also joined the Zoom's yoga class. When the weather was good, I used to use the weight machine that my husband had put outside, and we go outside and we walk. Of course, we walk with masks, and we don't get near anyone else, and we do everything we can to avoid COVID-19. Now, that doesn't mean that we're not going to get it, but if it gets us, it's going to have to work for it. Next slide, please. So I also thought about what can I do to maintain optimum health? And obviously, we follow the guidance that we've gotten from the CDC in terms of washing our hands and keeping surfaces clean. And as Daniel said, we make sure that we get enough sleep. Even though I must admit my sleep schedule has gotten a little off because I've been binging on TV shows that I never watched before, I still make sure that I get a minimum of 7 hours of sleep every night, and we're eating kidney-friendly meals. I mentioned that I'm staying connected with friends via Zoom. I haven't talked to many people on the telephone because I really have gotten addicted to seeing their physical cues. And I love reading books, not audiobooks, but I'm actually reading paperback and hardback books. These are books that I curl up with in the bed, and I usually wake up with the book under my head. that gives me an opportunity to get away, because I think it's important to respect our me time. I'm isolated here with my husband, and my husband is a wonderful person, but he's an extrovert and I'm an introvert. So he likes to talk a lot, and he gets his energy from talking to me, whereas I get my energy from being isolated. But I recognize that he is here to protect me, and so we try to balance our time to give him what he needs, but also to give me what I need. And we have talked about this extensively. If we decide it is necessary, we will seek professional help to help us deal with the challenges of living with COVID-19. Next slide, please. Next slide, please. Thank you. It's been a pleasure to share my perspective with you, and I look forward to addressing any questions that you may have. Thank you, Jerome.
Thank you, Glenda, and thank you, Dr. Cukor, for sharing your expertise. We definitely appreciate the information. We now want to hear from our audience. If you haven't already done so, submit any questions you might have for our panelists using the chat feature or the Q&A through WebEx. So we are looking for your questions for our guests here. We do have a couple of questions already. I think this question is for Daniel. It says, you mentioned burnout. What recommendations do you have to cope with the burnout, especially if I'm feeling overwhelmed with the burnout? It seems like this whole situation is never ending.
Thank you for the question. It's a difficult question to answer. Just from the phrasing of the question, it seems like this is never going to end. Seems like perhaps we're getting a bit too far ahead in our thinking. Like I suggested during my talk, really focusing on the here and now is something that can be very helpful, even though the here and now is, like you said, dragging out for a long time. Not being overly thoughtful about what 2 weeks from now or 6 months from now might look like, because it seems like it's, all of the information that we have is constantly changing anyway. So just really focusing on, for this week, what can I do to make this week a better week for myself? And one of the things that I encourage people to do also is to try to take not a vacation, but what they're calling a staycation, kind of staying home, but instead of, just doing your regular life duties, trying to really be thoughtful about, what are some of the things that you could do to make your life a little more enjoyable, to get a break from some of the monotony or the routine that we have fallen into, perhaps, as a result of, the limitations the pandemic has placed on us. So are there certain things that you can do, certain treats that we can have, that we can reward ourselves with, and really try to pack them into some sort of, 1 or 2 days of just indulgence so that we can feel a little bit better. Perhaps that will recharge the battery a bit so that we can begin to face, the challenges once again with some enthusiasm. Glenda, anything you would add to that?
No, Daniel, I think that is a good assessment. I think that one of the things that we all need to accept is the thing that Daniel emphasized, and that is to focus on the now. What can I do now? What am I experiencing now? How can I make now a good experience?
Great.
Okay. Thank you. We have another question, and I believe this one is for Glenda. Were you always so disciplined, or did the COVID environment encourage you? How long did it take you to create this type of structure?
Actually, I've always been very disciplined, but I was disciplined because I chose to be. COVID-19 has forced me to be disciplined and to do things that I might not have done otherwise. I think that for those of you who know me, many of you know that I slowed the progression of my kidney disease for more than 40 years using diet and exercise because I recognized the impact that it could have. So discipline is a part of my life, but COVID has taken this to a whole new level. And at times when I feel like I am not being disciplined, then what I do is I tell myself, it's okay to make a mistake. It's okay to slip up, but now let's get back on the program. And so I don't beat myself up when I fail to be disciplined.
Thank you, Glenda. We also had a comment from, I believe, a patient. Says, transplant recipient, for me, this is a real struggle, particularly living alone. Are your slides going to be available offline? And the answer to the question is yes. The slides will be made available with the recording. Again, within 3 business days, we will post the recording and the slides to the website. But I'm going to ask Dr. Cukor, any advice to help patients that are living alone cope during this time?
Yeah, it's a great question. It's certainly an additional challenge if we're living alone. And what I can say is that I've heard from people, some people have issues of too much togetherness, that they're kind of stuck in small spaces with other people, and they're wishing that they had more alone time. And there are some people that are alone and they are wishing for more together time. And I think, whatever it is that you think that you're missing from your life, you need to try to make an effort to, complementing it, to finding a way to do that. So, for example, there's certainly some risk in being with other people, but there might be ways that you can do it that are safer, that might even be safe enough for you to go ahead and do that. And that's a conversation I would really strongly suggest that you have, with your healthcare team about, because, in some ways it's like the easiest thing to say is, oh, I'm not going to go anywhere. I'm just going to lock the door. I'm going to be totally safe from COVID. Well, that is, from an infection control perspective, that might be a reasonable response, but from a living for 9 months like this, that might not really be what's in our best interest. So, depending on your particular risk factors and your particular health concerns, your physician might be encouraging of you to take a limited or very calculated amount of risk to be able to socialize or to do some things which are a little more connected than perhaps, doing nothing. And on the other hand, if you can't do if those opportunities aren't available to you, as much as most people really don't like connecting through technology, this is something that we, I think, have to kind of just force ourselves to do. I'm somebody who's used Zoom for many years in my practice. So I work, with 7 or 8 different dialysis centers, and I cannot travel around to each of them that readily. So I've been Zooming with patients for a while, and certainly the number of people who have become comfortable interacting in this way has skyrocketed through Zoom. So I think that's just one of the things, one of the positive things that has come out is that I hope telehealth becomes a more regular part of people's experience. Certainly it's not, great for everyone under all circumstances, but it might provide one solution to barriers to care that many people experience as well. So I think in terms of, reaching out to your social network, again, finding ways through technology that might be okay, but not quite ideal, this is the time to kind of live with those types of situations.
Thank you, Dr. Cukor. We also have another comment from a patient. She says, my husband is a home hemodialysis patient, and I know we did better when the weather was warmer and able to go for walks and motorcycle rides. The winter is very scary as far as slipping into depression. We do all we can to isolate. Any advice for a patient like this or a caregiver like this?
Well, my comment is, certainly being a home patient, has its advantages in terms of, the ability to limit the exposure to other people and to travel. So there's certainly a positive side, and a lot of people are interested in, at least around here in New York, about kind of thinking about whether home hemo is an option for them. And I do think certainly, though, on the other side of things, that it can create an environment where you are a bit more isolated. So I think it is challenging. I certainly agree with you that when the weather was nice, it was easier to find activities that were safe and you could do outside. And now that it is cold, it is really very, very difficult to do so. I think that is a challenge. I mean, I think the way that I would probably encourage you to go is that there has to be a difference between isolating yourself and perhaps distancing yourself. You can physically distance yourself from other people, but you don't really need to isolate from them. They have to find other ways to connect with them. There's online support groups that are through Zoom. There's online everything these days. I mean, any business that wanted to survive has kind of figured a way to do this through some sort of technology. So there are many more resources that are available now for people that are at home than there have ever been. So I just encourage people to be a little more, ingenuitive and kind of put some effort into figuring out what's, of interest to them and seeing what other people have figured out in terms of, how they're connecting with each other. So, I mean, you mentioned motorcycle rides. That's certainly difficult in the winter weather, but, are there motorcycle enthusiast groups that perhaps you could join on Facebook or in other places and just, it might not be the same, but at least it's something where you can get some of that expression out or connect with other people who are also kind of commiserating with you about the impact of the cold weather.
And I think we have time for one last question. Wanted to get this to you both. How do you know when you need to seek professional help?
Glenda, you want to go first?
Sure. So one of the things that my husband and I are constantly on the lookout for is whether or not we are constantly sad for a number of days. Because there are ups and downs. There are days that everybody around here is happy, and then there are days that we're kind of blue and gloomy. And we have agreed that if we observe that either of us seems to be constantly sad or hostile or angry for a sustained period of time, that we will voluntarily seek professional help.
That's a great answer. What I would add to that, I think, is that, in some ways, it's a personal question about where do you draw the line as to when you need professional help. I'm here, as I said, in New York City. So, there are parts of New York City where it's very in vogue to be in therapy. There are parts of New York City where people would, the last thing they want is any kind of connection to the mental health team. So I think for you, the question is, what's the downside of connecting, to a professional? It's so easy now, because of telehealth, to set up a Zoom session with a licensed mental health provider, that having a conversation with them, even if you don't absolutely need it, seems like pretty low risk to me. So I would encourage people to, just get out there and to try it and see if it's of any help for you at this point. The other thing that I would say is that there are many standardized questionnaires that are out there that you can take online. So if you're concerned that you might be depressed, there's an instrument called the Patient Health Questionnaire 9, which is free, and you can take it online, and then you can score it yourself, and you can see if your score is too high, they suggest that you get some help. So there's, all these self-help quizzes that are out there, for all the different types of problems that people are having, but none of that is really a substitute for talking to a professional and getting a thorough, psychiatric or mental health evaluation. So I would say if you're concerned that perhaps you should, there's really very small downside in reaching out to somebody, to set up an appointment and speak with them. And if it seems like it's a good connection, like they might have something to offer, then great. And if not, perhaps you can reach out to somebody else and find somebody who's a better fit for you.
Dr. Cukor, Glenda, thank you both for all the information that you provided today. Lots of great feedback to our audience. So thank you both.
Thank you.
Thank you.
And I was just told by my team that the slides from this presentation are up on the ESRD NCC website. So next slide. For additional COVID-19 resources, visit the ESRD NCC website resources webpage. The webpage has lots of great information, from where to find credible online information to ways to empower yourself, to learning how to connect virtually with others. The COVID-19 Patient Resources webpage offers a variety of information. You can access handouts, webinars, videos, and links to trustworthy organizations. Check back often because new resources are added frequently. Next slide. We also want to tell you about another resource page, where to find credible information. This document provides sites for general updates on items like hand washing and disinfection or face mask use. Good resources include the CDC, CMS, and the Department of Health and Human Services. And for chronic kidney disease-related updates on COVID-19, the ESRD NCC website, CASER, and the ESRD Network's website. Check out kidneycovidinfocenter.com and click on For Patients to access this document. And for our final resource, we want to let you know that we've updated the kidneyhub.org with a diet and nutrition section. This new section contains information to help kidney patients and family members learn about the kidney diet and healthy eating habits. The Kidney Hub is easy to save to the face of your cell phone or other mobile device for quick access. Check it out today. And as a reminder, our patient COVID-19 webinar events are every other week. So our next patient event is Tuesday, January 19th at 4 p.m. And the next professional COVID-19 webinar event is next Wednesday, January 13th at 3 p.m. Thank you all again for being with us this afternoon. For additional COVID-19 resources, visit the CASER website at casercoalition.com. Thank you, everyone. Have a good evening.